Good afternoon and welcome back. We are welcome to have you join us for this final session of today. This is Be the Captain of Your Own Care. This is a panel discussion with two patient advocates who will share their experiences facing kidney disease and their hopes to improve kidney disease patients' lives. So let's go ahead and quickly take a look at the agenda for today's session. So we have with us Beatrice Williams, who is the Outreach Coordinator for the ESRD Network of Texas. We also have, who's trying to join with us, Derek Forfang, who is with the HSAG ESRD Network 17, and Precious McCowan, who is a Legacy SME with the ESRD Network of Texas. We're going to talk to you a little bit about them, introduce them in more detail in a little bit. We will, as with our other sessions, allow questions and answers after they provide the panel discussion. But as in the other sessions, don't feel that you have to hold on to your questions till the end. Feel free to share those questions with us either through the chat or the question and answer session, and make sure that you send them to all panelists. We can go ahead and have the next slide. So at this time, I'd like to introduce you to Beatrice Williams. And Beatrice is the, as I said before, the ESRD Network of Texas Outreach Coordinator and the Emergency Preparedness Liaison for the Texas Emergency ESRD Coalition. She has more than 18 years in the healthcare and social services. Beatrice has a master's in human relations and business and a business and bachelor's in social work. In her role in the network, she collaborates with the Texas state representatives and healthcare clinics to improve client engagement, emergency preparedness, and community-based programs. And Derek Forfang, who you'll meet shortly, has been a type 1 diabetic since age 10 and an ESRD patient since 1999, utilizing various treatment modalities, including transplantation, peritoneal dialysis, and in-center hemodialysis. Both his mother and grandfather were type 2 diabetic and experienced kidney failure as well. Derek is the chair of the National Forum of the ESRD Network Kidney Patient Advisory Council, and member of the Forum Board of Directors. He is the chair of the HSAG ESRD Network number 17 Patient Advisory Committee and chairs the Network 17 Board of Directors. He serves as the chair of the National Kidney Foundation's Kidney Advisory Committee and chairs the NKF Public Policy Committee. He is also a member of the Kidney Health Initiative, Patient and Family Partnership Council, as well as a member of the NPFE-LAN. Derek's very busy. I'd also like to introduce you to Precious McCowan. Precious is a 2-time kidney transplant recipient. She was diagnosed with kidney disease in 2010, and she received her first kidney and pancreas transplant that same year. The kidney failed after 7 months. Precious received in-center hemodialysis for 8 years, during which time she started her patient advisory journey. Now, her advisory work includes facility patient representative, chair of the ESRD Network 14 of Texas Patient Advisory Council, member of the ESRD Network 14 Medical Advisory Board. She is a legacy subject matter expert for the ESRD and National Coordinating Center. She is a patient representative of the American College of Physician Care Coordination, and she's also a peer mentor with the National Kidney Foundation. Precious also received her second kidney transplant in April of 2019. Precious earned her Bachelor of Science in Criminal Justice and her Master's of Science in Human Behavior while on dialysis. She is currently pursuing her doctorate degree in the field of human behavior. So just like Derek, Precious is also extremely busy too. So at this time, I'd like to turn it over to Patrice, who is going to oversee this panel discussion. Patrice?
Good afternoon, everyone. Thank you so much, Kim, for the introduction. I will keep an eye out for Mr. Forfang as he joins our call. And of course, it is a pleasure to join you all today for our PFE Summit. I am really excited to join both Precious and Derek. Such an amazing bio that you've read. They both are certainly very busy. And we just want to applaud all of you for everything that you are doing to support the kidney community and your dialysis facilities and transplant facilities as well. And so I just want to thank you all once again for taking the time out of your day to join us. And of course, welcome Precious and Derek. So as we wait for Derek to join, of course, I would just like to kind of get another introduction, if you will, to Precious, and just kind of give us a little bit more information on what was your dialysis like, and can you just kind of briefly describe the treatment that you have received?
Absolutely. It's hard to describe it quickly, but I would like to just take you on this brief little journey about my my healthcare background. So at the age of 9, I was diagnosed with type 1 diabetes that was well controlled until I went to college. The entire 4 years that I was in school, I did not, manage my diabetes well. I must admit that I did not follow my diabetic diet, check my blood sugars as directed, nor did I follow up regularly with my endocrinologist to gain better control over my diabetes. So 2 years after graduation, my doctor noticed that my kidney function was slightly declining. My GFR was 87, which placed me at stage 2 CKD. So at the time, I was told that no kidney therapy was needed and that I needed to ensure that I monitor both my blood sugars, my blood pressure, and follow my diabetic diet. So, being very young at the time and thinking that I would be okay, I never thought to ask more questions about kidney disease. So I then began to do my part, but CKD began to progress. So I was then referred to a nephrologist and was told that I was at stage 3A CKD. 1 year after being diagnosed with stage 3 CKD, I became very sick and had to undergo emergency dialysis in the hospital. And I later learned that my kidney progressed into end-stage renal disease. So I did in-center hemodialysis for 4 months, and then I received both a kidney and pancreas transplant. But unfortunately, both transplanted organs only survived 7 months. So I went back to in-center dialysis for 8 years until I received my second kidney transplant in 2019. So that's my journey in a nutshell.
Thank you, Precious. So throughout your journey, what would you say has been the most challenging aspect of being diagnosed and living with kidney disease?
That's a good question, So when I restarted dialysis after the rejection of my first kidney and pancreas transplant, everything about kidney disease was challenging for me. I didn't know much about dialysis. It was challenging just trying to understand and grasp my doctor's recommendations for my care and ask questions or seek help to be more involved with my care. But I later learned that I was depressed, and I ignored the signs of depression and ignored that I was still deeply grieving the loss of my 2-year-old son, whom passed away unexpectedly 4 days before my first kidney transplant went into rejection. So as I learned how to defeat depression, I became more alert and involved in my health, and then became the captain of my own health care. But it wasn't until I, effectively addressed my mental health challenges So for me, the most challenging aspects of living with kidney disease are the mental tolls that can affect you emotionally and physically, causing you to be disconnected from yourself and others.
So let's kind of park there a little bit, Precious. You mentioned mental health, and oftentimes a lot of patients, they experience mental health. So as you realized that you too were experiencing depression and other mental health, such as anxiety, or mental health falls under various categories, what are some tools that helped you cope with those challenges? More specifically, not just the mental health, but also your loss of your son and your transplants. What are some tools that you can kind of speak to others so that they too can glean from those and possibly apply it to their situation if they should identify themselves in that similar circumstance?
Absolutely. I know that we all are different, but during that time, you know, I depended heavily upon my faith. And I did so by praying and actually asking God to stabilize my mind and deliver me from whatever it was that was causing me to become depressed. I also rely on some of my peers that are, you know, tuned in today. And I don't know if my good friend Derek has joined yet, but it's been times where I've spoke to Derek on several occasions, and I have shared my concerns, and Derek will, you know, give me his advice and tell me about his experience, and that has helped me to cope. I also, another thing that I like to do, I like to meditate, or as I'm meditating, I know it sounds strange, but I walk. And I know taking long walks sounds a little cliche when you're talking about dealing with depression, but it actually works for me. You know, when I walk, it gives me the opportunity to basically clear my mind and, you know, get in touch with nature and admire God's beautiful creation. So for me, I think when I am depressed, this may sound a little unique or strange, I basically need that alone time. And in that alone time, I reflect on things that I have overcome. And I always say to myself that God would not put more on you than you can bear, and that whatever comes my way, I will get through it. So that's what helps me.
Okay, that's great. So from what I hear is not only did you have a peer support, which, you know, NCC offers a lot of those tools as far as their peer mentoring program and other outside organizations, you also took a moment to do some self-reflection and self-meditation. In addition to both of those components, you too sought, you know, guidance and comfort in your own personal religious beliefs. Is that correct? So all of those tools helped you address those mental health challenges and other things that you were experiencing, and from that you were able to cope.
Absolutely.
Great.
Absolutely.
Okay. So through your journey and everything that you've shared with us, not only just your transplant journey, and you obviously have gotten wonderful degrees during your kidney diagnoses and treatments, what are some of the most important learnings of your journey with kidney disease? What is something that you could share with others?
Absolutely. And so I'm going to take my time with this area because, you know, this is something that I've had experience that has really saved me. So one of the most important learnings for me is paying attention to my body and communicating my symptoms to my healthcare team. You know, over time, I have learned how important it is to communicate with my healthcare team any unusual signs and symptoms. I stress this learning because several months after I received my second kidney transplant, I was experiencing some swelling, cold symptoms, and some BM issues, just to say it nicely. I was told that the symptoms that I was experiencing, that they were normal at the time and would level out. So my transplant team wasn't concerned. You know, my labs were okay, and the transplant center was ready to, you know, graduate me to come in for labs once a month instead of biweekly. But due to my symptoms, I did not feel comfortable. You know, I wanted to continue coming into the clinic biweekly until my symptoms had gotten better. So gratefully, and I'm happy that my transplant team, they did agree with me. Unfortunately, my symptoms did get worse, and I reported them each and every time. And it's a good thing that I did so. So my transplant team, they decided to take further action, and despite what my labs were indicating, and they decided to run a BK test. And BK is a virus, well, they call it BK virus, but it is something that is in all of our systems. It mainly occurs during childhood. And, you know, when you are immunosuppressed, the BK can attack the kidney. So come to find out, my BK levels were extremely high. My transplant team had to start IV infusions right away. And come to find out as well, I was going into malrejection. But me being proactive and communicating my symptoms and what I was feeling, you know, I saved myself from going into another kidney transplant rejection. You know, this could have turned out bad for me had I not said anything. You know, I could have been back on dialysis instantly. So I stress to you all today, please pay attention to your body and communicate any unusual symptoms that you're having.
Absolutely. I completely agree with you. Being comfortable enough to share your experiences and things when you know your body better than anyone, and being able to have that relationship with your healthcare team and speak to your concerns, and also be your own advocate. That has been spoken throughout today's summit. Being able to be your own advocate and to speak to your concerns, being able to do your own research when you know, okay, this may not work well for me or something is not right, being able to do all of those things and go to the proper professionals and say, let's have a conversation. And so I'm grateful that you did do that, because it did prevent you from having a transplant failure. So that is certainly an important thing for us to take away from today, along with everything else that has been discussed. But those opportunities to just say, I need to have those conversations with my medical professions and to listen. That's the most important thing, making sure that they listen. Mm-hmm. Absolutely.
I'm sorry. Before we move on, you brought up like being your own advocate. And before I actually joined the NCC and the Patient Advisory Council for Network 14, I didn't really understand, I didn't understand what that meant. I always felt a little intimidated approaching providers about my health care and what I thought would be right for me. So it wasn't until I joined those groups and connected with my peers and others that are just like me that I gained the confidence to communicate what I was feeling and to be my own advocate. So I'm very grateful for the NCC and the Patient Advisory Council for Network 14. I just wanted to add that.
Okay. I'm glad you did. because that is important to be able to not only be your advocate, but when you join the NCC and you join your network PAC committee, it allows you to be a voice for others who may be a little shy, or they may be an introvert, or not realize that they too can be their own advocate. So you can step into that gap, if you will, to help guide them through and to help share all of the educational materials that we produce, and to make sure you can speak to your own personal experience as well. Because sometimes when a patient speaks to another patient, they hear it better than it coming from a professional at times. Because while you have that personal experience that you can speak to and say, I truly understand, you have a level of empathy that some may not be able to specifically share, if you will. So it's definitely important to be able to be a voice when some feel like their voice is not being heard, but that's just my take on it. So I'm glad that you and so many others have joined the NCC and PAC to do that. So with that being said, what role did your family play with encouraging you to be involved in your health more? I kind of know a little bit about this story, but I want you to share it.
Yes, absolutely. My family has really encouraged me in ways that they are unaware of. I remember after the rejection of my first kidney pancreas transplant, I was in and out of the hospital, and a lot of times my family couldn't be there because they had to attend to their own responsibilities. So even when my family was available to be by my side or help me, I would always tell them, I'm okay, you don't have to worry about me, I'll be all right. For some reason, I always have figured things out because I never wanted to be a burden on my family. I've always been a very independent person and felt like, oh, this is my battle, I need to get through it. So I know that this seems a little strange, but in those moments, I actually felt empowered to thrive and push through adversity. In those moments when I was alone, that actually pushed me to, just push through and to not give up. So, my family, they have always, referred to me as the strong one. And I never really understood what that meant. And so I remember before my mother passed away from health issues, I remember one day asking her, why do you, refer to me as the strong one, even in my darkest hours? And she said to me, Precious, no matter what life throws your way, you handle it with grace, and you do not get discouraged by your circumstances. You make living your life look so easy. And so that has always stuck with me. So basically, my family has encouraged me to keep fighting and moving forward. And I actually share this with individuals that I mentor. And so, basically just going through this fight, I know a lot of times we say we're not alone, but there have been times when I was alone. And I think during those times when I was alone, and I'm speaking like in the hospital room, no one was there for me or could be there for me. Not that they wasn't there, they couldn't be there. It gave me time to reflect. It gave me time to think of a strategic plan as to what is next. How am I going to handle this? How am I going to get through this and overcome this? So, at those moments when I'm alone, that's when, to me, I did my best. So that's how my family has encouraged me, by telling me that I'm strong, and it encouraged me not to give up on myself.
Very good. Amazing. And so when you are learning to how to be strong and how to not give up and those things, what are some things that you feel like are more important that you can help patients to live well with kidney disease?
That's a good one. I like that question. You know, basically, living with kidney disease, you know, it can be challenging for most. Really living with any chronic condition can be difficult. You know, there are a few important concepts that I have here that I believe would help us live better with kidney disease. One is establish a relationship with your healthcare team. This can help you be comfortable communicating your concerns and your healthcare needs. Number two, be engaged with your care. You know, ask questions. Over time, this will help with shared decision making. You know, as I have become more involved with my care, my healthcare team are much better with assuring that I am part of decisions that are made for my care and for my treatment. And so I stand firmly on the saying, nothing about me without me, and I challenge each and every one of you all to carry that statement with you when you are working with your healthcare providers. And three, most importantly, please take care of yourself mentally and physically. Do the best that you can with following your healthcare regimens and following up with your physicians. I say this because I've always wondered, what if I had taken diabetes more seriously and did my part by following my healthcare recommendations? I always say to myself, would I have been faced with kidney disease and having to do dialysis? You know, that's something that I really never know. So please, you know, do not ignore nor discount your health. Take it seriously and do your part to be as healthy as you can while living with kidney disease.
Absolutely. Do your part. Definitely do your part. And as you are living with kidney disease, and we all are unfortunately still experiencing COVID-19, how did the COVID pandemic change your experience as a transplant recipient?
Oh, wow. Well, first of all, with the mask and the wearing of the gloves, well, mainly the mask, I was already practicing that, you know, with the transplant because to me, my transplant was still new. And so when I would go out in public, I would wear a mask. When I was around family members, I would wear a mask. And, you know, at that time, I was already in practice for it. But it has really taken a mental toll on me, I must be honest. I am a people's person. I love connecting with others. So having to separate myself from family members, close friends, it really has. It has taken a lot over me. But I'm grateful for Zoom. I'm grateful for WebEx. I'm grateful that I still get the opportunity to connect with my peers. But from time to time, I get a little lonely, even though I don't live by myself. But, you know, I do. It has taken a toll on me mentally. And I have to refer back to my coping strategies to get me through it all.
So what are some, just give us 3 coping strategies that you do.
Well, number one, I pray. Another one, in addition to what I mentioned earlier, I make sure that I connect with someone daily by phone, or, you know, if I'm just doing a basic Zoom meeting, that has helped me. And you know, of course, taking walks and exercising. But I always have to make sure that I connect with someone every day, you know, because I already feel like an outsider because most of my time has been spent inside the house because I am fearful of COVID and what the outcomes may be for me and individuals like myself.
Okay. So in speaking of those fears, what are some of your hopes and fears for the future concerning you are a transplant recipient and all the things that others are experiencing, whether they are inpatient, home, dialysis patients, or even transplant recipients? For you and your specific experience, what would you say are some of your fears and hopes concerning it? Just
some
like
of my hopes, and I'll just speak candidly. Some of my hopes is that there are more innovative ways or more innovative kidney therapies that give us the freedom, dialysis patients, the freedom to have a better quality of life, that there are more innovative interventions that, minimize symptoms from dialysis, you know, the fatigue, the brain fog, the mood swings, you know, that is my hope. And I hope that eventually that we could get rid of COVID. I believe that's everyone's hope, that COVID would just go away and we can get back to normal. But until then, I hope that everyone remains hopeful, you know, and do their part to stay as safe as they can. And some of my fears, and this is a personal fear for me, is I've already experienced one kidney transplant rejection. I was close to experiencing a second kidney transplant rejection. So one of my fears is losing this transplant and having to restart dialysis and, you know, just losing hope and thinking that a transplant may not be for me. So that's one of my fears. And I shared that with you all. I never told my family that. So you all are special.
And that's a realistic fear that anyone has. But with that being said, when you are feeling a certain fear or you need to cope, you mentioned Mr. Derek Forfang as one of those persons that you call and talk to, and he has joined us today, so we're going to take a moment to kind of speak with him. So thank you so much, Precious, for opening up and sharing your entire experience with us, and hopefully someone was able to glean from all the coping tools that you shared and your experiences, as also being an advocate. And as you said, nothing about me without me. And so that's something that people can take away from today, to be your own advocate, to make sure that you listen to your body, to make sure you look at those clues and cues that your body is sending you if you are experiencing depression and all of those things that you have shared with us today. I thank you so much for doing so. And also just recognizing we are human. We have fears, but we also have hopes. So we're going to lean more on our hopes so that they can overcome all of our fears. So thank you so much, Precious, for that. I appreciate it. Welcome, Derek. I hope we have a moment that we can just talk to you. So it's a pleasure to meet you again.
Certainly.
Of course, we were just kind of talking about our different experiences that you, Precious, and all of our other wonderful guests today have shared about their kidney disease. So with that, What is your diagnosis? Well, I should say, what can you briefly describe as far as your treatment and how you receive dialysis, your overall experience?
Yeah, my experience started with trying to get a preemptive transplant for my father about 22 years ago. And we had some issues kind of getting timing started. So I ended up actually having to go on in-center dialysis for about 7 weeks. And then I got the transplant, and we had some issues with it. So I had about 3 years with that transplant. Started on PD, was on PD for a few years, and then spent 12 years on, about 9 years on in-center dialysis till I got my transplant that I currently have. So it's been quite a journey.
Yes, sounds like it. So in your journey, what have been some of your challenges?
Well, I learned early on, and I'm sure Precious shared this too, that, I really had to be engaged and know what was going on. I think a little bit of a benefit for me is I was type 1 diabetic since I was a kid. So I was used to managing my health to some degree. And that's where I kind of came up with this whole theme about being the captain of your own care, because many times, we're our first line of defense. And I think this last year with the pandemic has really brought that to light, that, we need to be able to take care of ourselves at times. It's, I had a lot of times this year where, I couldn't see my doctors face to face. And it was a little bit challenging. Had to do a little bit at home to manage what was going on with blood pressures and all my medications. And then with what's recently happened in like the state of Texas, where, unfortunately people couldn't get out and get the care and treatments they needed. So I think it was even more important that, we're really truly engaged in what's going on. And when I say engaged, I don't just mean, that your doctors and phone numbers to call, but that I learned, what my medications, not only what they were and what color the pills were, but how they worked, the timing of what they worked, what they did to my body. And I found during dialysis, I had a lot of trouble with, when I was in center, on my blood pressure. And so I would actually had this strange way, and I worked with my doctors to get this worked out, but I would actually watch my blood pressure, and then when it rose back to a certain point, I would give my medications, and it tended to smooth everything out. It was a different way to do things than my doctors were used to, but, I had communicated with them well. We had a great rapport. And so they said, well, this looks like it's working for you, so we'll let you just manage it this way. And understanding all those things actually saved my life. And, I actually, after my last transplant, it's been almost 8 years now, at Stanford Hospital. I was there in the hospital. My kidney was a sleeper, so it didn't start right away. So I was still on dialysis, and I was there in the transplant, right beside the transplant center, doing dialysis, and I had a heart attack. This is about a week after my transplant. And they actually pushed my dialysis chair through the hospital and up into the emergency room. And I was feeling terrible, but I didn't quite know what was going on. And, they called out a code blue, and in a certain room, all of a sudden I see myself going in that room. I'm like, oh my God, what's going on?
Wow.
Yeah. And so, later I was in the cardiac ICU for about a week, and we kept having trouble. And they had put me on a bunch of new blood pressure medications that, were better and newer than what I was taking while I was on dialysis. And it got to a point where, yeah.
So let me ask you,
sure.
Let me ask you this. Your theme is to be a captain of your care. And every captain has to be able to steer the ship and guide us. But during that time, a captain will kind of experience some different storms. So with that being a captain of your care, how did you manage to cope with those challenges? You're coping with having a heart attack. You're coping with, not being able to be around people during COVID-19. What are some of your coping mechanisms during that, Captain?
Yeah. Well, I guess my coping mechanisms, first of all, is to, engage with my support team, my friends that are in the kidney community, my family, make sure they know what's going on, if I'm having any issues. I do reach out. I have Zoom and various ways that I can talk to my my doctors, and in that case, it was just reaching out. I've done a really good job of creating a care team for myself. I'm lucky here in the San Francisco Bay Area to have so many choices as far as physicians and hospitals. So I've actually had to let doctors go before because they weren't listening to me. And so I've created a great team, and we have great rapport. And I think when I was in the hospital, that's really what saved me, is they were willing to listen to me, say, you know, I took atenolol and minoxidil when I was on dialysis, and they're not great medications, but they worked. And when I expressed that to them, I'm like, maybe we need to come off of these new blood pressure medications for now and try these old ones that I was using and understood. And when they changed it, I was out of the hospital within 24 hours. So I think it's just important that, things settled right down. And later I was able to get off those meds and get on newer and better drugs. But it just shows how important it is that you have care providers who listen, people who are supportive, understand that we know our bodies, and are really there for us. So I think that's how I hope.
With you being so knowledgeable about your health and being able to develop your own healthcare team, that is absolutely amazing that you are able to do that, and to have doctors that you can fire and say, I have enough people who are advocating for me, enough people who will have me in the best of care. What sort of things would you suggest to patients to become empowered and be able to take control of their health and their life, especially for those who may not be able to develop their own healthcare team? What are some takeaways that you can provide?
Well, I think always, knowledge about what's going on knowledge is power. And so the more you know, the more you can speak up for yourself. And I've learned so much, not only from my physicians who have taught me a lot, over this time period, but fellow patients and friends, and watched their experiences and saw what happened to them, the good, the bad, the ugly. And, because when we talk, we really can talk to each other like I can't talk to my family as open and honestly about how I feel about my health, because I try to protect that.
You talk to Precious.
I can lay it out to Precious and tell her exactly what's going on with me, how I'm feeling emotionally, and we get each other. So I think that's important to have that community, and I think we're lucky, those of us that are on in the ESRD network community, that we know so many people around the country, and we can reach out, and all of us that work with NCC get to know each other on our teams, and that's how I've kind of developed those friendships, and many people I've known now for a long time and got to know them personally and met them, and so it's been a big positive for me. And even this year, having Zoom calls with friends has been a big blessing.
That is a big blessing. It's always a blessing to be able to have that extension into your family, your internal family, but your extended family as well, and all the opportunities that the NCC offers, and your network and your healthcare team. All of those persons can come together and empower you to have a better health, a better lifestyle. And so that's wonderful. Thank you, Derek, and thank you, Precious, so much for sharing your journeys. I love anything on a positive note, and that is a beautiful thing to know that you can be your own advocate, be your own captain of your care. Also, nothing without you, about you without you, nothing that will be able to stop you from just going forward and moving forward to being your own transplant recipient, as Della mentioned in our previous conversation, being able to understand your mental health so that you can apply those coping skills. So I thank you both so much for taking time to speak with me today. It's been a pleasure. And Kim, I pass it to you, ma'am. Do we have any questions for them?
Thank you very much. I would like to thank all of you for your time. This has been a fantastic panel. We appreciate the discussion. For all of you who have joined us, please use either the chat or the Q&A if you have any questions for our panelists, either Derek or Precious. And while you are sharing those questions with us, Matt, if I could have the next slide, please. There's just a couple of resources we wanted to share with you very quickly. This one is perfect because Precious did talk about some of the things that she did for her own emotional well-being. The NCC has a journaling resource on its ESRD NCC website. And for those of you who may not be familiar, journaling is writing down your thoughts and feelings, and many people find that this helps them with their well-being. So we actually have some journals online that you can download. They are pre-created journal templates, and or you can just use some prompts that we've created, and you can create your own journals. So they are available at the website there on your screen, esrdncc.org/patient, and then just select mental health or the well-being section. Next slide. And then finally, we just want to also let you know that there are many NCC resources available on the website for patient and family members. And the resources provide information about what to expect as a newly diagnosed patient, understanding the grievance process, choosing transplantation, which is a great topic for what we selected to, talked about today, choosing home dialysis, again, another great topic for today's sessions, infection prevention, emergency planning, as well as caregiving. You can also view those on our website, esrdncc.org/patient. So now I'd like to go ahead and get back to our questions, and we can share those with the panelists. We received a few. This one, Precious, I think it's for you because I know a little bit of information about you as well. But Derek, maybe I don't know something about you, but this one, it says, I know you like to dance. What has dance done for your mental health?
Oh, I'm telling you, dance has really helped my mental health. I forgot to mention that I feel free when I dance. I really do. It energizes me. If you play a really nice song, gives me a good drum beat, I would just let loose. So dancing really does help me. It's helped a lot.
Yeah, that's really Precious's question. That's not to me.
And Derek, is there anything that you do for your emotional well-being that's helped you?
Well, I just stay in contact with people. I just have a lot of friends I stay in touch with. I do have people that come here to the house, and I live with family. So all those things are a help to me. So that's basically what I do. And then, of course, I'm busy. So I think that has been super helpful this year, is to try to be helping others in a time that's difficult for myself, is more rewarding to me than it is to, anything that I'm working on, because it just keeps me focused and keeps me interacting with positive people in my life.
Very good. Another question we received, there are a lot of providers on the call today. What are some things we can do better to assist patients to better quality of life?
Well, I'll start. Oh, go ahead, Precious. I'll follow.
Oh, go ahead, Derek.
Well, I was just going to say, the first thing is to listen to your patients, to ask your patients questions. I really think that you should find out what's most important to us as people, whether it's school, work, traveling, seeing family, spending time with our kids, taking care of an elder parent, all those things, and then try to build a treatment that supports that. I think sometimes we throw a treatment in there and really don't pay attention to what the person's dealing with as far as stresses or joys, and we need to really understand that best and then match a treatment that supports, what makes them happy, and I think the results will be better.
Absolutely. I have to agree with Derek on that. And to add, it's important to speak the language of the patient as well so that we can understand and feel comfortable sharing our concerns or, our health needs with you all. I know with my dialysis nephrologist, he made me feel so comfortable. And as Derek mentioned, he learned about me as a person. I remember when I lost my son, when I had to go back on dialysis, and because he was still my nephrologist, and my mother, he checked in on me. When he make his rounds, he would ask me how I was doing. He would ask me about my family and even school. And it just really made me feel like he was concerned and that he cared. So that's very important.
Thank you for sharing that, Precious. We also have another question. This is directed to both of you, Precious and Derek. How did you get started with working with your Network PAC committee, your Network Patient Advisory Committee?
I can go first. Okay. Well, I'll try to make this story very short. I remember my PAC, the PAC members were at I believe it was like an NKF summit, and they had the opportunity to speak about the PAC and what they are doing. And I remember going up to one of the members asking, how can I join the PAC? Because at that time, I was right at the beginning of being involved with my health care. And she told me to talk to my social worker, and I talked to my social worker, and at that time, they can only have so many PAC members. So I applied, and the social worker said, well, they have your application on hold. They will get back to you. They don't have an opening at the time. And so I waited like 6 months before I was contacted to join the PAC. And I actually saw the patient advisory director, I believe, at another summit. And I asked her about my application. And literally, I guess a couple of weeks after that, which was within that 6 month range, they contacted me and asked me to join the PAC. So I was very grateful. I had to wait, but I was grateful.
Yeah, I was asked in my clinic by my social worker if I'd be interested. And I'd never heard of the network before. I'd been on dialysis, probably 5 years, and I'd never heard about the network or didn't know anything about it. And they basically were doing a newsletter for patients. This is about 11 years ago. And so I was kind of helped edit that. And then wow, it really has changed. And so over the last 10 years, it went from finding recipes for this newsletter and trying to come up with patient-centered articles to really being engaged in what's going on and really opened a whole new world for me. So it's been, it's been such an awesome opportunity working with my network.
Very good. Thank you for sharing that. And for our final question for both of you, I think this is a great question to end this session on. What is something you wish people knew about living with kidney disease?
I'll go.
Precious?
I would like people to know that it's not a death sentence. You know, you don't have to be live your life as if you're confined to kidney disease. Don't let it define who you are. Don't give up on yourself. Still continue to do the things that you once loved and did before you were diagnosed with kidney disease. I'll be lying to you if I say, oh, yes, every day is easy and it's great and I can still do everything I used to do. No, it is challenging, but I stress to you to, just keep continuing to live life. Life is already short, so don't let kidney disease define you. Continue to live and thrive.
Thank you, Precious. And Derek?
Yeah. Oh, I completely agree with Precious. I think, I want people to know that, don't feel sorry for me. But on the other hand, sometimes I may look great on the outside and feel terrible on the inside. So, need people to understand that even a transplant isn't a cure. And certainly dialysis isn't a cure. That's really hard on us and really difficult. And I think many people feel like, oh, well, you're on dialysis, so now you're okay. And, or, wow, you got a transplant, so now you're cured. And there's still a lot of challenges that go with that and, fills your life up. So I think I wish I knew people knew a little bit more about what the struggle's like for all of us. But on the other hand, don't count us out. That, we want to keep friendships and we want to socialize. We want to keep doing the things we enjoy to do.
Very good. Thank you. And we just received a comment in the chat that she wanted to thank the panelists for noting the importance of not providing cookie cutter treatment, just being seen as a CKD patient versus individual with various needs enhances trust and improved treatment designed for the needs of the CKD patient. So thank you for sharing that with us, Eva. And at this time, I just want to thank our panelists and Derek and Precious, and I'd like to thank Beatrice for doing a fantastic job as the moderator for this session today. This does conclude our final session for the day, and we want to thank everyone for your participation during the first day of the NPFE-LAN Summit. We'd like to invite you to join us again tomorrow. We have another exciting day planned for you tomorrow. We start at 11 a.m. Eastern Time with a welcome from CMS. So you will want to please join us again tomorrow for that welcome. And then we will be followed immediately after that welcome with a session about the COVID-19 vaccine. So if you're interested in learning more about people with kidney disease and the COVID-19 vaccine, that's a session that you will definitely want to attend. So thank you for joining us today. You will be receiving an evaluation after this session. We look forward to receiving your feedback and your input. It does help us, the NCC and CMS, as we continue to create more programs in partnership with you. And again, thank you for joining us today. And we look forward to seeing you tomorrow.
Thank you, everyone. Bye.
Thank you.
Care.
Bye.
Thank you.